Hi everyone, welcome back to the channel. I'm Maria Robles, CEO and President of Robles BioCeutics, where we're redefining aging through cutting-edge regenerative dermatology. Today, I have the incredible honor of speaking with Howard Leonhardt, a true pioneer in regenerative medicine and bioelectric therapies. Howard has an extensive background as an inventor, entrepreneur, and innovator with groundbreaking contributions that have transformed cardiovascular health, organ regeneration, and beyond. He's also one of the newest members of our scientific advisory board, and we're thrilled to have him share his insights with us today. In this interview, we'll dive into Howard's inspiring journey, his views on the future of regenerative medicine, and how his expertise aligns with our mission here at Robles BioCeutics. So let's get started. You've been a pioneer in regenerative medicine and bioelectric therapies. What initially inspired you to pursue this field, and what keeps you passionate about innovation today?
Well, thank you for allowing me to talk about these things.
Thank you for being here.
Glad to be here. Back in the 1980s, we met Dr. Ray Scow, who was doing research on heart regeneration in Pittsburgh. And up until that time, we were making devices made of metal and fabrics to try to repair aortic aneurysms or to replace a heart valve. And we came across his work, and it was quite intriguing. He was injecting muscle stem cells to change a post-heart attack heart in animals, in that case, back into a beating, pumping muscle. And around that same time, that actually was 1988, and in 1987, I had read the book Body Electric, and it was written by Dr. Robert O. Becker, who's now passed away, but the book came out in 1985, and basically those two things converged together, the bioelectric part of regeneration and the work that Dr. Gao was doing with muscle stem cells, and we ended up converging the two into our research platform forward.
Wow, that's amazing. And it shows how you really led the way to the field. I would love to know more about the big moments that have been important to you. Looking back, which of your innovations or ventures are you most proud of, and why?
Well, I'm most proud of all the people that have worked so hard to develop the products that we've developed over the years. We're very lucky that over 600,000 patients have been treated with our Leonhardt inventions over the years. That includes a stent graft for repairing aortic aneurysm without surgery, a percutaneous heart valve, and we were the first in the world to develop stem cell therapy for regenerating hearts in humans. Dr. Ray Scow did that in 1988 in animals, and we pulled together a team, and eventually we took the one and only landmark prize in the history of man of being the first company to use stem cells to repair a human heart without surgery, and that was in 2001 in the Netherlands. I'm proud of all those things and all those people that were involved with that. And now today we're working on health span and longevity, and a lot to be proud of there as well.
Yeah, so you're great at making big moves into real solutions. But I bet there's one achievement from the past that you value the most.
Well, I can say that maybe there's one moment that I valued the most, and there could be of many moments, but one day back in 1997, I received a call at a very unusual hour, 3 a.m., and I answer it. I'm kind of angry and tired, and who's calling? And it's Dr. Barry Katzen from the Miami Cardiac and Vascular Institute. And he said, "I'm very sorry to bother you at this ridiculously late hour, but we have a special circumstance. There's a patient that is about to have an aortic aneurysm rupture perhaps, and the doctor feels that that patient isn't strong enough to make it through a normal surgery where you cut open your chest, break open your ribs, clamp the aorta, and take 2 to 4 hours to sew a graft in place." And he said, he called me and asked if there's any way that I could get to me, and to get one of your custom stent grafts for repairing aortic aneurysms without surgery. We made a small puncture in the groin and would run it up, and we would use the springs of the stent to hold the graft in place instead of having to hand sew it. So you don't have to cut your chest, you don't have to break your ribs, you don't have to clamp the aorta, which only takes about 10 minutes instead of 6 hours, and much less blood loss and much easier on the patient. And I said, of course. She said, there's one thing I didn't mention yet. The patient is in Vienna, Austria, but we check. There's a flight at 7 a.m. It's now 3 a.m. And if, you don't have to do this, but if there's any way in a miracle that you could pull yourself together, get down to Miami and catch that flight to Vienna, you might have a chance to save a life. So I had to go to the lab and unlock the building or the manufacturing plant, and pull out the custom pieces. They had sent me a scan of his aorta, so I knew that the top of his aorta was 30 millimeters and the bottom was 20 millimeters. And we pulled together. I took a few just in case, we'd have backups. Put it in my bag and got down to the airport all sleepy and splashing my face. Anyhow, I flew and flew. Of course, it's a long flight there. I get there and I get in a taxi and rush to the hospital. And when I get there, they're like, "What took you so long?" And I was like, "Well, it was kind of a long flight." And we go to put it in and we struggle to get it into the patient. Of course, after all this, his vessels were very crooked and they had some calcification. But we got through the struggle. We got it placed and it sealed off the aneurysm. The aneurysm is a bubble that if it's not sealed off, it'll grow and burst. Albert Einstein died of an aneurysm rupture. Lucille Ball, the comedian, Jack Ritter from the hit TV show Three's Company, all died of aortic aneurysm ruptures. So when it goes bad, it goes really bad.
Yeah.
And he sealed off and he was good. But the moment that I want to tell you about is Dr. Mendel took me to the waiting room, and there was two ladies. One was the wife of the patient and one was the daughter. And he explains to them first in German and then switches to English and kind of tells me what he says. And he says, this guy, at 3 a.m. got called and got on a plane and flew over here. And he said in his sentence, I don't think your father would be here if he wouldn't have done that, and if his company, his team wouldn't have developed this unique invention.
Yeah.
And they just looked up at me. They were exhausted because they had stayed up all night and I could see how tired they were. And they just said in a soft female voice, thank you in English. Thank you and thank you, which I can't say in the sweet female voice, but it was the sweetest thank yous I've ever heard in my life. And you get a thank you when you open the door, you get a thank you when you pass the salt, but some thank yous are a little bit bigger than others. And I was looking at the daughter. She was probably 23. And I was thinking all the things that she had forward that hopefully now her dad was going to be able to see, maybe getting married, maybe graduating from college, maybe having babies, the things that happen with people. And I was thinking, if we wouldn't have got there, if I would have just not, gotten up and not with our team developed that invention, that she would have been missing all of those moments with her dad. And it's, we work in healthcare, but it's a very human business, and that's a moment that I cherish. I got back to the factory, shut down the factory. We had 400 some employees, and I pulled everybody together, and I wanted them to feel the pride that I had in what we do and the importance of what we do. So I told that story to them, and some of the line workers started crying, and then it became a special moment for us all to share that this isn't just metal and plastics and figures on paper for money. It's human lives that are at stake, and so that it's hard to go to any other field when you have that experience that work is meaningful and
And it's moments like those that really puts purpose in what you do. So it's amazing to see how much your work has helped.
Thank you.
Now let's dive into one of your core areas of expertise, bioelectric and regenerative therapies. Can you explain the potential of bioelectric and regenerative therapies in revolutionizing how we approach healing and tissue regeneration?
Thank you. Once again, I want to thank my mentor and former friend, Dr. Robert Becker, who published the book Body Electric. He had a famous notebook entry that was in that book that said there must be a bioelectric phenomena to regeneration, because right before the salamander tail starts to grow back, the electrical signal changes. And that was the beginning of our field of research, and he's passed the baton not only to myself and Dr. Jorge Genovese, who I work with, but many others who have continued the work. But the simple way to explain it is that we communicate with the DNA of a cell to build RNA, and we can communicate with cell membranes to open and close ionic communication channels. That's maybe not too simple, but basically we tell cells to do things on demand, and maybe this is easier to understand. We tell cells to grow blood vessels, we tell cells to grow muscle, we tell cells to reestablish nerve connections, we tell cells to release proteins that promote elasticity. For stem cell homing, that's one of the big ones. So if we stimulate your face, we are able to get your own stem cells to home to your face or to your scalp if you're having hair loss, to your sexual organs if you want to improve those, and to joints to try to take away joint pain and inflammation. And we have been doing this research for a long time and getting better and better at it. And we learned over time there are very specific signaling sequences, the right pulse width, the right pulse duration, the right frequency, and sometimes the right amplitude makes a difference to get specific proteins to grow on demand. So we can grow blood vessels where we want to grow them, we can end inflammation where we want to end inflammation, we can recruit stem cells, all with bioelectric signaling. So we're extremely excited about bringing those products to market, especially in combination with other great products like yours.
Yeah, no, it's so incredible, and it shows how these treatments can make a huge difference. I imagine that such innovation doesn't come without its challenges. What are some of the biggest challenges you faced while developing new technologies, and how did you overcome them?
Well, there's nonstop amount of challenges. They continue today. 2 steps forward and 1 step back, and getting through the regulatory bodies is always a challenge. Translating early research, or particularly small animal research, to large animals, to humans, is difficult because they're not always the same as much as we would like them to be the same. And then also just getting people to understand what we're doing. Like some people look at what we're doing and say, oh, you have a 10 stimulator. And we're like, no, it's not exactly a 10 stimulator, but it kind of looks like a 10 stimulator. But it's, and then always raising capital is a challenge for any biotech or medtech. No matter how confident you are, it has to be in the category of risky investments, and it's not always easy to get people to understand it. I did that DNA test, and the DNA test showed a distant connection to Nikola Tesla. And Tesla was fond, he said he was trying to explain alternating current to investors of that day who were used to direct current and batteries, and he just couldn't get him to understand it. Even today, it's still kind of hard to understand what alternating current is. We plug in the wall and we know what it does, but we don't exactly know why it was better than batteries, which we knew, or direct current. But he said he got in a room and he held up a light bulb, and it lit up in his hand without any wires, and everybody wanted to take out the checkbook. So what he did is combined a company that had wireless electricity with AC, and then once he got the money in, he put, of course, with popular disclosure, the money into AC, and then that ended up being a big hit for Westinghouse, the company he sold it to. But he was explaining, like, you have to have a simple demo that people can understand. Something complicated that's unknown, it can't. It doesn't work to raise capital. So that's a challenge. So without the particulars, we pretty much have had to do the same thing, is take things that are too complex and galvanize them into something more simple to explain. And then before and after pictures. Here's the face before, here's the face after. And hair is really good because you can just see it so well. So we have thin hair before and thick hair afterwards. That helps us show, okay, this is what we do.
Love that. Your courage to face these challenges is really inspiring. It shows how working together is important for science. What drew you to join the Robles BioCeutics Scientific Advisory Board, and how do you see your expertise contributing to the company's mission?
Well, we have a lot of common interests in the research, and you have with you Dr. Jorge Genovese, who I've worked with in bioelectric and stem cell research for over 30 years. I think 30 years, 22 years. And he's one of the best in the business that there has ever been. I met him when he was at the McGowan Regenerative Medicine Institute in Pittsburgh, and you're very lucky to have him on your team. And
lucky to have you both.
And I feel proud to be on the Scientific Advisory Board. And obviously, after 42 years of doing this, which I can't believe is 42 years, we've learned some things that didn't work and worked in developing innovations and bringing them to market. And then more specifically, we've done thousands of experiments on trying to get skin to regenerate and what protein expressions seem to help. And we really, believe in what you're doing. That's one of the reasons I came aboard is, in simple terms, getting zombie cells to stop expressing damaging proteins, which your technology may be doing better than any other that came before. It's extremely important. It's something we very much believe in. It's a little bit different than what we were doing, so the two technologies could be very complementary. We're here at the Leonhardt Longevity and Wellness Med Spa in Newport Beach.
Beautiful.
We are opening up 120 of these locations, and we want to feature your product in every single one of them. And what that means is when someone comes in to get a skin procedure, at the end of the procedure, we would like to rub your serums in place, and then we'd like to send them home with you call it a bottle or a package?
Yeah, a bottle.
Bottle.
We're still trying to figure out the packaging, the right bottles for it, but that's the idea we're coming up. But thank you, and I'm really happy you think our work is promising. One area we're particularly excited about is the application of regenerative therapies in skin health. Where do you see the biggest opportunities for companies like Robles BioCeutics to make an impact in the next 5 to 10 years?
Well, I think that one thing that's happening is that people like myself, which I have a hard time believing at a certain age, which I don't even want to mention.
He looks great. He looks great. He looks amazing.
That we're all fighting it. My grandfather's generation, to be honest, like he could give a damn about aging. He was happy to get wrinkles and lose his hair and look old and be a grandpa.
My mom too.
And I just have to be honest that I myself and people that my peers, we're fighting aging more so than ever. Part of it is because we always have somebody around us that we see that has actively engaged in taking care of themselves, going to the gym or surfing or hiking or skiing, and then on top of that, using products and technologies, and they look dramatically better. I do not know Larry Ellison, but I just saw a picture of him, and they said he's 80, and I thought, wow, he looks like he's 50. Rick Springfield, who had the song Jesse's Girl, I just saw a picture of him, and I think, I don't want to get it wrong, but whatever age he is, he looked like 20 years younger. And we've all gone to our class reunions, and you see some people that look 20 years younger than their age, and you see some people that look 20 years older. And when you see that, you want to orient towards being like the good examples. And usually that's a whole program of good diet, good sleep, good stress management, and whatever products are available. But I think it's a very special time that not only can you look 20 years younger, but you can actually be 20 years younger with some of the technologies coming that are also available here.
And it's so exciting that we have all those technologies and new technologies coming out. Now, what emerging trends in regenerative medicine and bioelectric therapies do you believe will shape the industry in the next coming years?
Well, I'm very much on topic with that, and I believe 30 years from now, it'll be very normal to go into a total regeneration chamber, a womb for adults, that we will all, in 30 years from now, think it's normal to go back into a womb that has all of the stem cells and exosomes and bioelectric signals. Basically everything that happened in your mother's womb, we're going to re-enter it to reestablish our heart and our kidney and our livers and our brain and our skin as best as we can. It won't be quite as good as going back to zero, but it'll be a lot better than what we're doing now. And between now and then, that 30-year span, it'll come in pieces. We'll get better at regenerating skin, which is the number one topic. So in med spas, the industry saying is skin brings people in. And the other thing is I happened to go to the Johnson & Johnson booth. Everybody knows Johnson & Johnson, one of the biggest American companies there is. I was going to say health company, but they're more than that. They have Tylenol, they have Band-Aids, they have baby shampoo, things that we all see every day in our lives. And at that booth, they told me the highest volume selling product in the entire Johnson & Johnson universe is their skin products, centered by Neutrogena. And the founders of Neutrogena, by the way, have invested with us. They're part owners of this building that we're in. And that shows you the importance to society of youthful skin. And if I didn't say it already, in this industry, we say skin brings people in. And then when they come in, we try to see, well, do you want some hair treatment or joint health or sexual health, or are you interested to join our health span optimization or gut microbiota health? But overwhelmingly, 70% of the people that come in here because they want a more youthful skin. So that means the demand is through the roof, and partly because it's the number one window to your age.
Yes.
And I do want to say one thing, that Dr. Sanjay Bajraj, a cardiologist, Dr. Miller, a heart failure specialist, we were co-founders of Leonhardt Health. And to be honest, at first, we were thinking, we're serious researchers and doctors, and we've been working on heart failure recovery, working with Cleveland Clinic and other places. And we were wondering if going into skin was not at the caliber of the research work we've done before. We really have changed our mind about that, and we see this connection. And the connection is this, is that if people feel like they're getting an appearance of being more youthful and more vibrant, and they're getting compliments from their friends and family about how good they look, it has a direct impact higher than we ever thought on their health. All of a sudden, they are engaged. They start to see that actions turn to results, which means they not only look healthier, but they are becoming more healthy. Yeah. And we're now believers. We're believers that there's a direct connection between having your skin look more youthful and embracing a more healthy life that's going to help you live longer.
Yes. Now, these trends are so important to pay attention to, and Howard, your ideas have been so helpful and innovative, especially for people and businesses trying to create new things. And now, as a serial entrepreneur and innovator, what advice would you give to companies and startups striving to make breakthroughs in science-driven products?
Well, it's certainly a challenge. So one piece of advice is get ready to fight a long fight, because it's not a quick and easy thing. But I really believe what we're doing here, communication is very important. A lot of scientists think, well, our data speaks for itself, or we just need to focus only on getting the studies done right and everything will fall in place. But it's a noisy world out there, and it's hard for people normal people to understand graphs and data studies, and then somehow when they get published into these scientific journals, they use a bunch of scientific jargon that's hard for anybody to understand. And a big part of any invention is to people can't get behind it and believe in it if they don't understand it, and if they don't know about it, of course. And so what we're doing here is, trying to help educate, trying to get the word out, and your work of, taking zombie cells, which can be understood by people, and stopping them from expressing all of these bad proteins that cause inflammation and reduce the effect of anything else you're doing. So we were talking about our technology recruits stem cells to the face. Mm-hmm. Well, if we recruit stem cells to the face, but the face is all inflamed up with all these bad releases from the zombie cells, they're not going to be able to stay alive and graft and become youthful skin. They're going to die out and be ineffective. So we think we're going to start now, to ask people before they come in to apply your Robles BioCeutics skin serum for weeks before they come, and then continue to use it after they leave, because we think the combination will be a much more powerful therapy for skin rejuvenation than either alone.
Thank you. And we're so excited for it to come out. And that's such a great advice to everyone. Now, it's obvious that you have a strong beliefs that guide your work. So here's my next question. What is one area of research or development that you are most excited to explore in the near future?
Well, we've spent, out of these 42 years, we spent more time and more money learning how to regenerate hearts. So it all started with the heart. Walt Disney is a hero of mine, and he said it all started with the mouse. Well, for us, it all started with the heart, and we continue to work on being better than anybody else in the world on regenerating damaged hearts, which 64 million people are in heart failure. So that's a big one. But everything we learned in regenerating hearts with all that money and all that time, again, in 1988, we worked with Dr. Ray Scow to do the first animal study. We're now applying to other things. So what happened with us is we spent all that time, 1988 to 2008, is that 30 years?
Wow.
Working on heart regeneration. And then in 2008, we put together a laboratory, which now the laboratory location is about 2 miles from here at the UCI Cove. And that lab was designed to explore whether everything we learned in regenerating hearts could be used for anything else. And boy, has that worked. So 38 different applications have been developed: skin regeneration, hair regeneration, joint health, sexual health, brain recovery after strokes and brain injury, and then just brain health, helping people that are aging to keep their memory, keep their cognitive function. And it all pulls together to eventually we're going to have what we really most look forward to is a total body regeneration chamber. So for my kids, grandkids, I hope they're proud that the total body regeneration chamber that's most regarded in the world it came from our work. That's what I hope.
It's great to see how you think about the future of medicine. I'd also like to know what you believe in personally. Do you have a guiding philosophy or principle that has influenced your work over the years?
Well, then thank you for a chance to talk about that. And I always like to thank my parents first, Michael and Penny Leonhardt. They both were hardworking individuals and great examples. My mom had an interior decorating business, and she operated out of the house and would be sewing into the midnight hours, curtains for people and things like that. She was very creative. And my father operated machine shops, and he was also a hardworking, creative person. I've had many influences that really have a big meaning for me, and Thomas Edison is very close to the top of the list, an inventor who just plowed through all the obstacles to invent amazing things. And I always wanted to follow him in being a great inventor. Walt Disney, we're here in Orange County, and Walt Disneyland is here, and just his spirit and the way that he applied creativity into practice, was a great example for me. Steve Jobs, founder of Apple, the day that Apple became the most valuable brand on the planet in April 2011, I was the one and only person at his house on that day, not with him, at the house where Apple computers were first built, which was his parents' house, but
like those bubble Apple computers?
It were Apple, the garage and the house where the first Apple computers were built. And I just on random was driving there from the Google headquarters, and on the way there, it was announced that day, and I'm there at that place, and it was a spine-tingling moment, and it became even more spine-tingling because right around the corner from where his parents' house was, where they built the first Apple computers, was a Trader Joe's store. And I stopped and I came in, and our wine, we make wine, Leonhardt Vineyards wine, was on the special display right as I entered the door, and I thought, this is a magical day. He was a big influence. No one really needs to be told, the contributions of Apple Computer and the technology person kind of winning out in the direction of the company over the money people, which I'm a technology person, so I really, really cherish that. Tom Peters, an author, has been a big influence, and he talks about building an innovation culture, and I've always, followed his teachings, and so those are people. Guiding philosophy, I'm unusual in being Buddhist-Christian, and I had a chance to have time with the 14th Dalai Lama, and it highly influenced my life. And basically that's a practice of reducing suffering by controlling your mind, and I like to apply that to the people in our organization to keep a culture of joy and happiness, and instead of focusing on the negative. I did forget to mention that one of the highlights of my life, which is a lucky life, was to have a day with Richard Branson, a serial entrepreneur. Most people know him from Virgin Hotel, or Virgin Atlantic Airlines, or Virgin Cola. and it was delightful to have a chance to ask him a few questions, and then reading all about him. And what I most admired about him was the simple thing that I heard that he treated everybody the same as he would treat the Queen. And when I saw him in practice, he did that. We went to go to the VIP wine tasting, and I didn't have a VIP pass. We had a little booth there for a little winery, but that didn't give me the VIP pass. And they wouldn't let us in. And he said, "Take my badge," which Richard Branson VIP. And I'm like, no, I'll go get a badge. You don't. And he said, "I insist." And then he goes and waits in line, doesn't ask for any special treatment, buys another badge, and yeah, you know, I try to handle myself with the grace and humility that he has, and I think it makes it better working with people if you treat the secretary the same as the Queen, or the janitor the same as the CEO, and I try to practice what I learned from him in one day of being with him and reading about him.
That's incredible. Like, thank you for sharing your story and ideas, Howard. Your work in healing medicine and now at Robles BioCeutics is really important, and we're excited to continue this collaboration. To our viewers, if you enjoyed this interview and want to stay updated on the latest in regenerative dermatology and our groundbreaking work at Robles BioCeutics, don't forget to like this video and subscribe to our channel and turn on notifications. Your support helps us bring more inspiring content like this to you.